5:40, only on Sunrise. NBC5 News and Asante are continuing to team up to bring you better health.
Yeah, since February is American Heart Month, we're talking about the importance of heart screenings. It's time for Better Health. I'm joined here with Asante health expert Beth Coker and Linda Pearson. We're talking about cardiac screening today.
And Linda, we know that heart disease is the #1 killer for both men and women in the United States. So what kind of screening test do you use on a patient to detect heart disease?
Screening tends to revolve around a person's risk factors as well as their heart health behaviors. Risk factors would include things like family history of heart disease or vascular heart disease, congenital heart disease, problems with diabetes in the family, high blood pressure, that kind of thing.
So what are the types of tests then you would look for heart disease in a patient that might have some of those symptoms?
We want to explore some of their heart health behaviors. We usually will start with what's their blood pressure doing? What's their food choices like? Do they have a reasonable level of exercise, kind of on a planned basis? We would screen for their cholesterol levels, see how they're tending to run. We usually check a blood glucose level, and then a discussion about what are their food choices, exercise, as well as are they a smoker or non-smoker.
So if they're having symptoms, are you going to do tests like an EKG? Do they still do stress tests? What kind of things do they do then with the patient?
EKG is pretty fundamental, so that will almost always be done. An echocardiogram or an ultrasound of the heart is really key for identification of a heart's anatomy. It gives us tons of information, size of chambers, and how well is the heart ejecting blood, how much blood is being ejected with each beat, how are our heart valves looking. So that's a real key. Depending on the individual and their situation, treadmill stress test is super common. Gives, again, a lot of information because it's kind of simulating life, you know, because the heart's under exercise.
And if a patient comes in and says, "Doc, I feel some of these flutters in my chest, maybe it's an electrical problem," what kind of test do you use for that?
We have quite a few things available to monitor a person's electrical rhythm. When they feel that, we can get them on anywhere from a day heart monitor to a month heart monitor. We have all our cardiologists are very well trained in electrical problems. We have specialists called electrophysiologists that are highly trained in electrical problems. So depending on what the outcome of the monitoring is, then they're appropriately routed to the next specialist.
So if a person is having some symptoms, when do they know to go see their doctor and talk about heart risk?
We need to be really in tune with ourselves. So if we're engaged in activity and we're starting to get a lot more tired than we normally would with that particular activity, that's a little bit of a warning sign. Certainly if we have any problems with chest discomforts, pain, pressure, tightness, squeezing, that's a warning sign. If we're getting short of breath more easily than we would have, say, a month ago with the same activity, that's also a warning sign. Unanswered fatigue levels that, oh, this never would have made me tired in the past. Those are problems that you want to seek assistance and workup from your provider.
Great recommendations.
So know your body, see the doctor if something is off. All right, thank you so much. We'll be right back.